Washing our hands seems like something everyone knows how to do, right? In this video, I'm going to use a black light and this stuff called Glo Germ to demonstrate how well I'm actually washing my hands. Hand hygiene when you're compounding sterile medications requires a knowledge of how and why it works, as well as knowing and observing certain behaviors for keeping your hands clean. You'll see here that I'm really dousing my hands in this Glo Germ stuff to illustrate the point, and you'll see in just a second that this really glows under a black light when you have it on your hands, or any surface for that matter. So now that I have the Glo Germ on there, let's get a black light and check it out. Look at how this lights up like a Christmas tree. Very evident that I have it on there, and unmistakable. Now let's go through the technique of washing our hands. First, make sure to remove all jewelry from your fingertips to the elbows. Generally, it's a good idea to have either short sleeves or roll up your sleeves, because next you're going to wet your hands and arms up to the elbow. Ideally, a hands-free sink should be used so you don't need to touch anything after hand washing is complete. The water should be warm but not scalding. First, you want to remove any debris from under your nails using a nail pick. You could also use one of these iodine-soaked sponges. If you do use one of these sponges like in this video, be sure not to use the abrasive side, as this will just create more particles and skin shedding. Be sure to use the sponge side. There are a few parts of your hands that need special attention. Your fingers and the balls of your hand represent a critical part of your hand because this is how you pick up objects. It's essential that they must be clean. Also, the area between your fingers can be difficult to clean, so pay attention when you're scrubbing to cover the entire surface of your fingers. What I like to do to ensure that I'm covering all surfaces and scrubbing them with the proper amount of time is to sing my ABCs quickly, starting with each finger. I'll then move on to the ball of my left hand and palm. Next, I'll scrub the back of my hand to my wrist. At this point, I'm going to switch hands and scrub my fingers and hand up to my wrist of my opposite hand. After both hands are scrubbed to the wrist, you'll move back to your first hand and scrub around your arm all the way up to your elbow and then your other arm. You're then going to rinse your hands starting with your fingers and slowly raise your arms up so that the water is being rinsed towards your elbow and into the sink, not allowing anything to drip back onto your fingers. Using a low linting wipe, ideally this would be sterile as a best practice. Gently pat your hands dry. So how did I do? Well, you can see that there's a couple marks on my hands where it really glows and sticks out, but for the most part, I did a halfway decent job. Of course, that one spot on my fingertip right there, that's not good. But this is the process improvement tool that you could possibly use to make your hand cleaning process perfect. In the next video, let's use this Glo Germ stuff to see how it works with glove sanitization.